Hi, welcome to Case Study 2. My name is Nicole Marstall and I will be presenting today. The client for this case study is a 4-year-old male with a diagnosis of autism spectrum disorder. The problem behavior we will be discussing today is disrobement of shoes specifically. Disrobement of shoes was defined as using hands or feet to remove one or both shoes off of one's own foot. An example of this would be grabbing the back of the shoes and pulling them down to remove the shoe from the foot. A non-example would be accidentally stepping on the back of one's foot while walking or running and the shoe coming off accidentally. The intervention used was operant extinction. Operant extinction is not providing reinforcement to a behavior that was previously getting reinforcement and maintaining the behavior. Operant extinction was selected to decrease the frequency of occurrences that shoe disrobement was happening. When the behavior was first observed, there was antecedent behavior consequence data taken, referred to as ABC data. Upon analyzing the data, it was shown that the disrobement of shoes was happening most frequently after the presentation of a new or difficult task or demand. The consequence most often implemented was prompting the client to put their shoes back on. After observation, it was concluded that the function of the behavior was escape. The therapists were actually reinforcing this by requiring the client to put their shoes back on right away. This is due to leaving the original demand that was new or difficult and switching the demand to putting their shoes on, which was considered a master task. For this intervention, the disrobement of shoes was attempted to be blocked beforehand. However, if not successful, the client was required to complete the original demand first, then put their shoes back on, and then they were able to receive reinforcement. This meant that the client was not escaping the original demand due to removing their shoes. A differential reinforcement of alternative behavior procedure was also implemented. Rather than disrobing shoes after the presentation of a new or difficult task, the client could be reinforced for engaging in an appropriate behavior. Appropriate behaviors included stating, "This is hard, I need help," or "I need a break." A break for the client meant that they were able to sit at their workspace or lay their head down quietly without other reinforcers present or without engaging in those other reinforcers. This would be an unconditioned reinforcer, as stating or as resting is an unlearned behavior that everyone requires to survive. So everyone needs to sometimes sleep or take a break and take a rest. Stimulus control was also considered in the intervention. So stimulus control means that someone may act one way in the presence of a given stimulus and another way when the stimulus is not present. During this intervention, we also were not to use the phrase "it's time to work" or another phrase mentioning work. Work was a stimulus that signaled the presence of potentially difficult or new demands that would lead to the behavior of disrobing shoes. Instead, we use generic phrases such as "we're going to do something else," "it's time for the next thing," or even just calling the client back to the table in some instances. However, the table also was a stimulus that signaled work. So when possible, we would do our teaching trials in whatever environment the client was already engaging in. So this could have been on the floor, on the rug, outside, just wherever the client already was, and meeting them there at their level instead of making them come to us wherever we were. So in conclusion, the intervention was successful. By using antecedent manipulation through understanding stimulus control and changing what we were saying and the environment that we were in, it increased the likelihood of responding without engaging in those problem behaviors. The DRA procedure also taught the client appropriate ways to either ask for help or ask for a break rather than disrobing their shoes. Disrobement of shoes occurrences have decreased down to a few instances a week rather than multiple instances per session, which is a huge improvement. We also continue working to decrease the occurrences of disrobement of shoes down to 0 occurrences over a week's time frame. However, decreasing occurrences has been effective and would mean that this intervention has been successful thus far. Thank you for watching the presentation of my case study, and I will see you next time.